My name is Alice Kitu. I'm 34 years old. I was diagnosed with a sickle cell sickness when I was 6 months. I'm the first of 4 children. My sickness is something that is supposed to do with the blood. Sickle cell is, when you have the crisis, it's very painful. It's difficult. People sometimes shine your company. When they are doing hard work, you can't do some, because if you do it, your crisis will come. And then this morning I was not too good. I'm not fine. I have a little crisis all over. So I came to the sickle cell clinic to be checked out. It's nice, but we wish we have a 24 hours service here.
I wake up, I see you as you leave. I feel it, I see it as you leave. When we kiss, I went deep, but you're far away. Everything, treated me like I was a queen. What spell did it cast on me? Or was it a make-believe? You say, girl, never be.
On a daily basis, we have a lot of patients that walks in for treatments. In our clinic, we treat them very well. We have enough time for them, and then we make sure that they are very well satisfied with the treatments that we give them. Our busiest days are on Mondays and then Thursdays. And on a daily basis, we see on the average, about 50 patients. And then due to education and then talks around town and some media platforms, we now get an average of 3 a day. New cases. People walk in to know their status. Some to come in directly with lab reports indicating that they have the condition. We are living with sickle cell. It's a tropical disease. With the research we have done as an institute, I believe that sickle cell is in every family. And you don't have to look at the physical person or the body before you can determine. So I would advise that as we are marking the World Sickle Cell Day, all Ghanaians, both young and old, should just go and test. And then this is a technical advice. When you go or you see your doctor, you don't just ask for sickle cell test, but maybe you ask for HB electrophoresis. That is what will determine your traits.
Sickle cell comes with a lot of psychological disorders. Usually we have these anxiety disorders, we have these depression associated with sickle cell. So we try to help them overcome these challenges. The symptoms that sickle cell has is universal. Okay, when you go to America, Europe, Africa, is the same. But what the challenge is the etiologies, how we understand it. In Ghana here, a lot of people demonize it, especially some pastors and some juju men demonize it. So the individual tends to believe that this disease is caused by something outside. So usually they are helpless, and because of that, even when they come to the clinic, they don't even adhere to routine medications because they think that, oh, there's a spirit outside me that is causing it. Now, when we come to the society, it's not everybody who knows much about sickle cell, and a lot of myths around that sickle cell people die early, sickle cell people cannot get marriages, even if they do, they are not able to really maintain these marriages because they cannot get pregnant and all that. So because of that, a lot of them shy away from people. They don't want people to get to know that they have sickle cell. It will amaze you that people marry and their partners don't know that they have sickle cell. So all these things brings a lot of challenges, especially if you are in a society where you are not accepted. Okay, there are a lot of things that you cannot do. It will impact on you negatively at school, everywhere. So most of them don't even go to school because of the teasing. Because in quotes, they say you are a sickler. So every day they think you are sick. That is the stigma that really, really worries them. And this, some of them are not able to handle it. It can give rise to depression. A lot of them are depressed, and when you are depressed, you will get frequent crises, and this frequent crisis can also give rise to a lot of complications associated with sickle cell. It was recent that the newborn screening came on. So usually children come in 4 years, 3 years before they realize that they have sickle cell, and you find both parents sitting in front of me here crying because they have no idea. They didn't know that before somebody gets married, they have to check their sickling status and know whether they are carriers or they have sickle cell or they are normals when it comes to the hemoglobin. So their first child came, this child has sickle cell. They come here crying, and I have to explain to them why the child has sickle cell and what they have to do to really take care of this child, to live a good quality life, even though they have sickle cell.
I wake up, I see you as you leave.